With outpatient naloxone prescribing becoming more popular and a lot of public health initiatives pushing for naloxone to be prescribed, there's a lack of guidance on how to actually operationalize this whole process, whether that be from actually prescribing to filling a prescription and talking to a patient about this. So one of the biggest challenges that a pharmacist has is identifying patients in conjunction with a prescriber who really is at risk of opioid overdose. And so everyone generally thinks about the patient who has substance use disorders or using illicit substances, but there's also another patient population from more of a medication safety perspective, patients who are on concurrent medications that increase their risk of respiratory depression, also patients who have concurrent comorbidities that may increase their risk. And then your patients who are just on a large amount of narcotics or opioids for therapeutic reasons. So that's one challenge that pharmacists have, is actually identifying them and letting the prescriber know. Another one is actually providing information on how to write a prescription, because not all of the naloxone options that are available are just the medication. There's administration supplies needed as well. And if a prescriber just writes naloxone, that prescription is really not fillable and able to be dispensed at the outpatient pharmacy. So creating kind of templates that are available, so having templates available for prescribers is something that we've definitely worked on as well. Another challenge is cost. So these medications aren't free to patients, and we want to give them to a lot of different patients and different individuals. And so I think sometimes pharmacists run into a patient that's not able to afford the medication, as well as the administration supplies, because they're not covered by commercial insurances. Often they're considered durable medical equipment. So that's another cost to the patient, and that is sometimes cost prohibitive as well.